Hi, I'm Marguerite Robinson. I'm going to talk today about cerebrovascular accidents, or more commonly referred to as strokes. I will be discussing the etiology of cerebrovascular accident, types of cerebrovascular accident, types of ischemic strokes, treatments of ischemic strokes, types of hemorrhagic strokes, treatments for hemorrhagic strokes, risk factors, tissues and organs that are affected by a cerebrovascular accident, signs and symptoms of a stroke, long-term consequences, and prevention. The etiology of a cerebrovascular accident, or cause, is an interruption of blood flow to an area of the brain. There are three main types of strokes, each of which explains how the blood flow is interrupted. While these types describe the cerebrovascular accident that has occurred, they are not an indication of the varying degrees of damage that can result. The first is an ischemic stroke. According to the American Stroke Association in 2015, ischemic strokes account for about 87% of all cases. Ischemic strokes happen when there is an obstruction in the blood vessel to the brain. Another type of stroke is a hemorrhagic stroke. In 2013, according to the American Stroke Association, hemorrhagic strokes account for about 13% of stroke cases. This type of stroke happens when a weakened blood vessel in the brain leaks or ruptures. The last type is a transient ischemic attack, or TIA. These are referred to as mini-strokes. It is a temporary disruption of blood flow to the brain. The disruption is a brief blockage, hence no permanent damage. A TIA is a warning that a more serious stroke will happen in the future. There are two types of ischemic strokes. First is a cerebral thrombosis. Cerebral thrombosis is when a blood clot forms and clogs the artery. One way clots form is from plaque buildup. The second type of ischemic stroke is a cerebral embolism. This happens when a blood clot forms at another location in the circulatory system, usually the heart, then travels through the bloodstream. The clot will then become lodged in the brain where the vessels are narrow. I'm going to discuss three treatments used when an ischemic stroke occurs. First is a carotid endarterectomy. This is a surgery that removes plaque from the carotid artery. A surgeon makes an incision in the neck, exposing the carotid artery section that is blocked. A clamp is put on to stop the blood flow, at which time the surgeon will cut into the artery and remove the plaque. After removal, the artery is closed up and bleeding is stopped. The second treatment, which requires prompt actions, is clot-dissolving drugs. These drugs are administered intravenously and will restore blood flow before major brain damage has occurred. Carotid angioplasty is the third treatment. It's a less invasive surgery than carotid endarterectomy. During this procedure, the surgeon will insert a catheter with the balloon on the end, entering the artery in the groin and traveling up to the blocked area. The balloon is inflated to push the plaque to the side, and then a stent is inserted. The stent remains and allows the blood to flow to the brain. There are two types of hemorrhagic stroke. The first is an intracerebral hemorrhage. This occurs when a diseased blood vessel within the brain bursts, allowing blood to leak inside the brain. Uncontrollable hypertension or use of blood thinners can cause this to happen. Second type is a subarachnoid hemorrhage. This occurs when a blood vessel just outside the brain ruptures. When blood is released into the subarachnoid space, it irritates the lining of the brain, increases pressure, and damages brain cells. Depending on the severity, surgery directly within the brain may be necessary to repair broken blood vessels. During surgical clipping, a surgeon places a clamp at the base of the ruptured aneurysm to stop bleeding. Another procedure that is less invasive is endovascular embolization or coiling. This procedure cuts off the blood supply to the aneurysm. The coils fill the aneurysm, which blocks blood flow and prevents it from rupturing. Risk factors for a stroke include high blood pressure, obesity, cigarette smoking, alcohol abuse, drug abuse, high cholesterol, physical inactivity, poor diet, and family history. When oxygen is deprived, brain cells die. For example, damage to the right side of the brain will affect the left side of the body. Damage to the brain causes damage to other system functions of the body. If you think someone may be having a stroke, act fast and do the following simple test. Ask the person to smile. Does one side of the face droop? Ask the person to raise both arms. Does one arm drift downward? Ask the person to repeat a simple phrase. Is their speech slurred or strange? If you observe any of these signs, call 911 immediately. Getting to the hospital immediately will lead to a better chance of a full recovery. The effects of a stroke depends on where the damage occurs in the brain. Paralysis on one side of the body, vision problems, memory loss, speech problems, problems swallowing, and changes to emotions and behavior are long-term consequences. Prevention is the best protection. Eating a healthy diet, maintaining a healthy weight, exercise, not smoking, limiting alcohol consumption, and knowing your family history are proven ways to reduce your risk of a stroke.